Om Swastiastu, Doctor and colleague. We are from SGD B1, and today we will present our student project entitled Alopecia Areata. Here are our group member. Thank you for the opportunity. My name is Geg Mas Anantalakshmi with the last digit of NIM number 001. I will go over background information. Alopecia areata, an immune-mediated illness, is the second most common cause of hair loss. It is caused by the breakdown of immunological privilege in hair follicle, resulting in the formation of an alopecic patch. Hereditary, stress, and environmental factor can influence this process. Although treatment is not required, the condition can significantly impact a person's overall quality of life. It can result in mental health problems such as depression, anxiety, and sleep disorder. The next topic will be explained by my colleague.
Hello everyone, my name is Erick Gonata with 3 digit of my student ID is 096. I will continue my colleague presentations. So in this student project, we got 9 problem formulations, which are the first one is what is the definition of alopecia areata, followed by what is the epidemiology, what is the etiology and risk factor, how's the pathophysiology of alopecia areata, what's the clinical manifestation, how's the diagnosis and the differential diagnosis of this disease, and how's the treatment and management, and also the prognosis of alopecia areata. All right, so those 9 problem formulations are followed by as well 9 objectives: to know the definition of alopecia areata, to know the epidemiology, to know the etiology and risk factor, the pathophysiology, the clinical manifestation, to know the diagnosis as well as the different diagnoses, to know the treatment and management, and lastly, to know the prognosis of alopecia areata. And then here we got 2 benefits. The first one is to provide new understanding and insights regarding alopecia areata. The second one is to understand the differential diagnosis, treatment, and management, as well as the prognosis of alopecia areata. That's all from me. The presentation will be continued by my colleague. Thank you.
Hello, my name is Gusti Saraswati. My last digit number 056. Now I will explain about definition. Alopecia areata is medical condition characterized by sudden, significant hair loss. This condition occurs because the body immune system mistakenly attack hair follicle, which cause hair loss. That's all for me. Thank you.
Good morning. My name is David Christopher Chandra with the NIM 066. I would like to present about the epidemiology study of this disease. Based on epidemiological studies, the prevalence of alopecia areata reaches 0.1 until 0.2% of the total general population. A study proves that patients aged below 40 years old have a higher risk of developing it than patients aged above or equal to 40 years. Alopecia areata patients who have a family history of diseases range from the prevalence of 0% until 8.6%. Based on population studies, there is no significant difference in the incidence of alopecia areata in men and women. Male patients received an earlier diagnosis of diseases at an earlier age than female patients. The most common part of the body targeted by alopecia areata is the scalp, with or without involvement of the eyebrows, eyelashes, and beard. The occipital is the area of most frequently affected by this disease, with a prevalence of 33.4% in women and 38.4% in men. As many as 10.5 until 35.8% of people with alopecia areata will experience changes in the nails, such as pitting, trichinochia, and also longitudinal ridging. Epidemiological data of this disease in Indonesia is still very limited and requires further development to update this information.
Hello everyone, my name is Natania Sutedja with realized digit of student number 175, and I'm going to explain about the etiology of Alopecia areata. Alopecia areata etiology is still unknown, with many hypotheses being proposed. Some of them include immunological, genetic, psychological, and environmental factor. Alopecia areata is considered an autoimmune disease that is mainly associated with thyroid disease and vitiligo. In genetic factor, human leukocyte antigen DR on chromosome 6 is a common risk factor of alopecia areata. Some studies also show that emotional stress can contribute to the appearance of alopecia areata, and environmental factor can be a potential etiology that includes infections, vaccination, hormones, and diet. The alopecia areata patches in the scalp are most often initially located in the occipital and parietal regions, and neuronal etiology is suspected to be the cause of loss of innervation as well as vascularization in this region of the scalp. That's all from me. Thank you very much.
My name is Zephania Ekklesia, and the last three digits of my student ID number being 127. And I'm going to be explaining about the risk factors of alopecia areata. The first one is family history. A positive family history of alopecia increases the prevalence and the risk and the severity of the disease. The next one is autoimmune disease, named Graves' disease, psoriasis, and vitiligo increase the risk of alopecia areata. Although the exact mechanism is unknown, but it's hypothesized that the diseases share the same genetics. The next one is usage of nivolumab, which is a cancer drug. Nivolumab induces immune-related adverse event, which causes alopecia areata. And the last one is smoking cigarettes. Smoking cigarettes causes imbalance of T helper 17 and T regulator differentiation, which alters the hair follicle growth and causes alopecia.
Next, I will explain about the pathophysiology, but before that, let me introduce myself. My name is Putu Indriati with last digit number 231. The precise of pathophysiology of alopecia areata remains a subject of ongoing investigation. Current evidence suggests that this condition results from an autoimmune response directed against hair follicles influenced by a combination of genetic and environmental factors. The genetic factors and family history correlation between 10% until 42%. Environmental factors, stress on the hypothalamus pituitary adrenal axis, and other potential stressor, infection, vaccination, hormones, and diet. And last, immune profile zone, hypothesis of immune profile zone collapse in alopecia areata.
Hello, doctor and friends. My name is Geraldine with the last three digits of student ID is 100, and I'm going to present the clinical manifestations of alopecia areata. So the clinical manifestations include the presence of hair with patches with a normal skin and preserved follicular ostia, along with exclamation point hairs and nail dystrophy. For hair loss, the area most often experience hair loss is the scalp, but some may also occur on hair-bearing area, namely the eyelashes, eyebrows, beard, and extremities. And the most prevalent clinical types of patchy alopecia is characterized by smooth, sharply demarcated, and circular region of total hair loss that develop over a few weeks and could either stay discrete or even become broader to form certain patterns. The exclamation point hairs is a pathognomonic findings of this disease, and it is when the hairs are thicker at the top of the hair shaft and progressively thinner as it descends toward the base. And the nail dystrophy may show up before, after, or simultaneously with the active hair loss, and it is one of the most common nail abnormalities is nail pitting. That's all from me. Thank you.
Hello, my name is Marta and my last digit of student number is 064. Now I'll talk about the diagnosis of alopecia areata. The diagnosis of alopecia areata is primarily clinical and confirmed through physical examination and supporting examinations. I'll explain one by one. First, medical history. So things we need to know are the patient age when the disease occurs, the course of the disease, the symptoms, history of disease such as autoimmune or other inflammatory disorder, and family history. Second, physical examination of the scalp and affected areas. Third, dermatoscopy. So this diagnosis technique is very helpful in diagnosing alopecia areata. Dermatoscopy findings in alopecia areata include visible hair follicle openings without remaining hair soft, broken hair, remaining terminal hair, and yellow dots. Fourth, hair pull test. This test is very helpful in determining the differential diagnosis and determining disease activity. The hair pulling test is positive if more than 10% of the total hair pulled experiences loss, and this means that the disease is active. Fifth, a trichogram, which is a microscopic examination of a hair sample taken from the involved area. This test is not helpful enough to diagnose alopecia areata, but it helps to rule out several diseases that need to be differentiated differentiated from alopecia areata. And the last is biopsy. A small section of skin from the scalp is often extracted for examination under a microscope. That's all from me. Thank you.
Hi, my name is Caitlin, and I'm going to explain about the differential diagnosis of alopecia areata or AA. The first one is trichotillomania, is a compulsive hair pulling condition and is characterized by alopecic patches of odd shapes with broken hairs of different lengths and a negative pull test result. It's challenging to distinguish from AA, and the two disorders could coexist in some circumstances. Since alopecia is often non-inflammatory, biopsy specimens can also be utilized to distinguish this disorder from AA. The second one is tinea capitis. It's an inflammation, scaling, and pustules on the hair loss patch. Trichoscopy can be used to find hairs that resemble Morse code, zigzag corkscrew, and comma codes. Next one is syphilitic alopecia. It's a moth-eaten-like alopecia accompanied by a history of risky sexual behavior and a positive treponemal specific test results. And last but not least, we have scarring alopecia as a differential diagnosis, where the bald skin in this condition differs from AA in terms of strong inflammation and scarring development. That's all from me. Thank you.
Greetings, my name is Sutedja Karuniaputri with Trilas number 235. In these topics, we'll be talking furthermore about treatment and management of alopecia areata. Alopecia areata is an incurable condition, which means the main principle mostly has a role as a support to inhibit and change the immunological response. The most effective supportive treatments are topical steroids and immunotherapies. Apart from that, there are many factors that can be considered in providing treatment for alopecia areata, such as extent of durations, age, gender, duration, and others. The first one is corticosteroids. Corticosteroid considered as first line in alopecia areata, and it has been proven having a good progress compared by other drugs. The usual corticosteroid used was triamcinolone acetonide. The second one is immunotherapy. There is immunosuppressant for acute and rapidly developing alopecia areata and immunomodulators for chronic alopecia areata. Alopecia areata as an autoimmune disease proven to respond to immunotherapy, especially with diphencyclone-propenon, which actually they both with corticosteroid used together as better option. And next is psychological support. Alopecia is associated with psychological burden. Many psychological disorders could happen, such as depressive episodes, general anxiety disorder, social phobia, etc. Providing psychological support is expected to improve patients' quality of life with alopecia areata. This is the end of therapy and management of alopecia areata. The next topic will be brought by my friends. Thank you.
Hello, my name is Pande Karina Candra with my last student number R240. And now I'll present you about the topic 2.9, prognosis. So, alopecia areata is an autoimmune disease that can cause hair loss and can have an unpredictable course in both children and adults. Certain features such as an early age of onset, extent of hair loss, nail abnormalities, a positive family history for alopecia areata, and comorbidity with autoimmune disease can lead to a poor prognosis, and it is important to consider this factor when predicting the course of alopecia areata and the response to treatment. Thank you.
Hello, my name is Sabrina, and I will continue explanation. This is the ending part of our presentation, so here's the conclusion. So, alopecia areata is a medical condition characterized by sudden, significant hair loss. This condition occurs because the body's immune system mistakenly attacks hair follicles, which causes hair loss. The precise pathophysiology of alopecia areata, or AA, remains a subject of ongoing investigation. Current evidence suggests that this condition results from an autoimmune response directed against hair follicles, influenced by a combination of genetic and environmental factors. Alopecia areata, or AA, is an incurable condition. This disease is synonymous with sudden loss of hair from the scalp due to an autoimmune process. Therefore, the main principle of treatment is to inhibit or change the immunological response by modulating the inflammation that occurs. Thank you.
So that's all about alopecia areata from our group B1. Thank you very much.